welcome to this edition of the India Development Debate. I'm Nayantara Rai. Just when we thought that India was beating the coronavirus, there have been cases that are rising, particularly in Maharashtra. Once again, there is a scramble for hospital beds in the state. To add to all of this, the Indian government has confirmed the presence of and confirmed that the South African strain has indeed reached India. I'm going to be discussing this and more with two of the best doctors that we have in the country, Dr. Sushila Kataria from Medanta and Dr. Rahul Pandit from Fortis. Thank you so much for joining us here on this edition of the India Development Debate. Dr. Kataria, if I could come to you first. You know, it's very scary to talk about a second wave, a third wave, but let's put all of this in context first. We had started seeing cases come down, and now you're hearing about how in certain parts of the country, like in Maharashtra, it's going up. At a time when the vaccination drive is also 1 month old exactly. How serious is it? How, you're right there at the front. How bad is it?
So we are still fortunate that in the northern parts of the country, the condition still continues to be good and the cases have not started to increase. But I see down south and in Maharashtra, the cases have started to increase. And whatever this virus has taught in the last 1 year is that we cannot take it ever for granted. So numbers can increase. And while we are having an easy time in some states, I would request everybody to step up the vaccination drive, utilize this time maximally so that we can protect maximum number of people, not only the frontline workers and the healthcare workers, but I think the government should extend this benefit to the general public also, who are the deserving candidates to have this vaccine as early as possible if the vaccine is available for use.
We'll talk about the vaccine doses, the kind of supply that we're seeing in just a bit. But Dr. Pandit, coming to you now, in Maharashtra, are you starting to see a scramble for hospital beds?
So, Nayantara, thank you for having me on the show. Fortunately, no, we don't have the numbers that are actually creating a shortage of hospital beds. But in certain pockets of the state, certainly the numbers have gone up. And I think there are several reasons for that. So Mumbai saw a steady increase in the number for 4 days. And in the last 3 days, the numbers have decreased steadily as well. So it seems to be sort of forming up a wave pattern up and down a little bit. But certainly some of the districts like Amravati, Nagpur, Ratnagiri, I think, Akola, these are the places where the numbers have gone up steadily in the last 15 days. And there are several reasons for that. I think the commonest reason which everybody can attribute is that the single most important vaccine which we have with us right now is the mask, and none of them are wearing it. Most of them are actually not following the corona appropriate behavior. But that seems to be an across the country phenomenon. So why label up these 3-4 districts only as a culprit? There are certain super spreader events also which have been noticed here, where people have gathered for small house parties, weddings, which have sort of attributed to these kind of things. And I think most importantly, what we need to again re-emphasize is that corona has not gone anywhere. So the pseudo bravado of confidence that corona is not going to affect me, the younger population stepping out of the house, bringing the bug back to their home and affecting the older population of their home, is actually causing this spread which is happening. So I think we just need to re-emphasize that corona is very much there in the air. We need to follow our corona appropriate behavior, which is masking, sanitization, and social distancing. And we need to step up, as Dr. Sushila said, that if we have the vaccination drive stepped up, it would definitely benefit. But until then, the single most important vaccine which we have is still the mask. And even after vaccination, that mask has to continue. So mask up is what we need to talk about.
The mask is the biggest vaccine that people keep forgetting about. Dr. Kataria, if I can take that point further with you. Now, there have been a lot of WhatsApp forwards, a lot of misinformation that is also spread. And the reason I wanted to get two doctors like you on the show is also to address some of those things that are being discussed. Dr. Kataria, for example, there's a WhatsApp message that, did go viral, that people who have got the coronavirus vaccine in India got reinfected. Is that even possible?
No, this is not true that people who have got vaccine got reinfected because of the vaccine. It is totally untrue. And we as a hospital have vaccinated more than 5,000 employees. And we have not seen any incidents of anybody getting COVID infection because of the vaccination. This is practically not possible because all the vaccines which are being given, they are not full viral particle and they are not in a replicating form. And even if it is a full virus particle, it has been inactivated. So this is like any other vaccine. You get a measles vaccine, you get a diphtheria vaccine, you get a typhoid vaccine. This is like this is totally untrue. This is not scientifically possible for you to get COVID infection because of COVID vaccine. So please stay from this kind of misinformation. Yes, people who are getting COVID vaccine can have some effect similar to the infection, like getting fever, myalgias, or joint pains or something. We noticed that about 50% of the people who got vaccinated in our hospital got some some effects, I would say, not even side effects, like fever, etc., which is expected from any vaccine, and it is self-limited or gets better with few paracetamol tablets, and it takes only 3 days. So please do not be afraid of vaccine. All the vaccines approved by the government of India are absolutely safe. I am telling you from my personal experience, and we have done a large study in our hospital employees and found it to be absolutely safe. There is no side effect which cannot be managed with analgesics and simple paracetamols.
Dr. Pandit, if I can take that point further with you, this misinformation that has been spreading, that those who got the shot have still got reinfected, and at a time when the government is also now talking about for the next phase, making it for 50 years plus, the do's and don'ts, that those who get the first shot, that they must keep in mind. They must still wear a mask, they must still maintain social distancing.
Yeah, so look, I think what needs to be understood is that there are some people who have got tested positive after the first dose, but that is not because of vaccine, as Dr. Sushila said. The antibodies do not develop until 15 days after the second dose. The neutralizing antibodies do not develop until 15 days after the second dose, and that's bare minimum. It might take 3 weeks in some people, it may take longer than that. So the most important thing is that people who have taken the vaccine need to continue their corona appropriate behavior of masking and sanitization, social distancing, right up to the 31st of December 2021. I am actually giving more 8 months. I am not even talking about right after 2 weeks of their dose. No, absolutely not. Because we all know that we've had a good experience of flu vaccine. Okay? All of us in frontline workers have been taking flu vaccine for a number of years now. We know that the flu vaccine can give you a good amount of immunity, but does not protect you 100% from getting flu. So if I was to get a flu, it would be a milder variety of flu. And if something like this could happen with COVID, that you may get a COVID, but it would be a completely asymptomatic COVID because you've got vaccine and you've got protected, you would not fall ill, but you would still be spreading the infection. So for 1 year at least, please continue with your corona appropriate behavior. Mask till 31st of December 2021. Do not leave your mask. New Year without mask we can think of if the conditions are appropriate. But this year we have to basically give it to the mask.
Dr. Kataria, the government has been saying that for the next phase, it's going to make it for those who are aged 50 and above. Those who are below 50, would you recommend that they get flu shots? This is the point that Dr. Pandit was just raising.
So the who should get the vaccine first there has been already, the government has made a priority list. So I agree that from the experience we found that the disease was more severe in people who are 50 or more, or otherwise those who are having comorbid medical conditions. So all people above 50 years and lesser than 50, those who have diabetes, hypertension, obesity, asthma, or any severe immune compromising condition should get the vaccine as a first line thing. Once the vaccine is freely available, I would suggest everybody to take it. But till the time we have to do the rationing of vaccination, yes, the elderly and person with comorbid medical condition should be the first one to get it from now onwards.
Today, what Dr. Randeep Guleria has said, Dr. Pandit, and I'll read it out to you, is that vaccine will be available in open market only when prime targets are covered and there's equivalence of supply and demand. Hopefully there'll be such a situation by the year end or before that. Then there would be likelihood of the vaccine to come to the open market. So just looking at that timeline, just looking at what's happening in Maharashtra, what is your assessment that what we are seeing, the kind of unlocking that we're seeing, will continue till the year end. And Dr. Pandit, now you're going to have schools reopening, colleges reopening, people have started going back to offices, like you pointed out, they started going back to dinner parties and weddings also.
Yeah. So I think it's a very pertinent question, especially when states where Maharashtra, Kerala, Karnataka, where the numbers have gone up a little bit. Uh, I think what we need to go do is we need to re-emphasize what we just talked about, the corona appropriate behavior. We need to be a little bit more strict in enforcing our policies. Well, there are SOPs for weddings, there are SOPs for dinner parties and all those things. They need to be enforced. We need to sort of have that law danda being put up again, so that they are actually scared of it. That's one thing. And the third thing is that if there is a geographic area which has got large number of cases, then a small area to be contained and called as the containment zone, what we used to do before, probably needs to be reinstated. We need to have a building to be called up as a containment zone, or a lane to be called up as a containment zone, so that we restrict the movement of the people who are in that containment zone and they stop the spread. These things may have to come, but lockdown, I think, is not a practical solution, and we cannot afford it. So lockdown is not going to happen, but geological places where a small containment may be done is certainly something which we can do, and we should probably do.
Dr. Kataria, if I could come to you. Today you have seen officials in Maharashtra also saying there will be no lockdown. You've in fact seen them, travel in the trains, local trains, urging people to wear their masks. North India, like you said, has been better off than what we've seen in the West currently. But Dr. Kataria, children will be going back to schools and colleges. They are going back to offices and all of that. There is serious unlocking that is taking place at a time when we've also seen confirmation of new strains and mutants coming in from overseas, whether it is, for example, Brazil or South Africa. Those mutants, those variants, they can multiply, they can grow very, very fast. What would your advice be as far as travel also goes?
So I think we'll have to take the safety and the economy both together. So most important thing would like to tell all the listeners on your network that I was 11 months continuously into the COVID ward and not get infected only because of single one thing: my proper masking abilities, my wearing of mask properly for 11 months. And this is something when you're seeing 100, 200, 500 patients on a daily basis. So how effective a mask can be, I'm just re-emphasizing this to see the importance of mask to public. So economy has to open up. We cannot be in an indefinite lockdown. People have to earn, people have to survive. But with a little change, that once you can't see, you wear glasses. It's like that. If you have to stay safe, wear a mask. When you are in a meeting, wear a mask. When you go for a public transport, wear a mask. If everybody starts wearing their mask properly, even if the vaccination program is little delayed, which it should not be, then also we would be safe. We will be safe from all variants of COVID if we are even just wearing our mask properly. I will urge everyone to wear masks, observe social distancing, and do hand washing. It may take another 1 year for the whole situation to get under control permanently. And we will keep on seeing little rises and falls in number of cases. But our behavior, COVID-appropriate behavior, is what is going to make us survive through this. So far, we have done very well as a country, and I'm sure we will continue to do good.
1 year of lockdown is almost here. It's 11 months. Dr. Kataria, I'm going to give you the final question. Those who got coronavirus early on in the lockdown, they may no longer have the antibodies. There is a lot of misinformation, wrong information that is out there as well. Lack of accurate information. Somebody who had coronavirus, let's say, 9 months ago, 10 months ago, and it's not showing up in the blood test for antibodies anymore, can they be reinfected?
So very, very important question. And I wanted to touch upon this. So all those people who got infected, more than 5 million people have got infected with COVID infection. But how many reinfection cases we have? Only few numbered, like 50, 55. So the chances of reinfection are very, very less. With every infection, if the infectious disease we study, the antibodies and the immunity works at different levels. It works on B cells, it works on T cells. So it is very unlikely to get reinfected with COVID-19 infection after getting one proper infection once. So I would say, I mean, this is also, and these people who do not have antibodies, even if they take one dose, they are developing a very good immune response. That is what we have seen in our studies. So the chances and the scare of reinfection, I would say, is very, very minimal. Don't be scared, but still continue to observe COVID appropriate behavior. And in a situation where you have limited number of supply of vaccines, the people who have already got infected should be the last to be vaccinated. People who have never been infected with COVID-19 above the age of 50 years and having comorbid medical condition should definitely get the vaccine and get it as early as possible.
With that, I'd like to thank both of you, Dr. Pandit and Dr. Kataria, for joining us on this edition of India Development Debated, putting so many things clearly for all of our viewers.
Thank you, Nayantara.
Thank you. Bye-bye.
वैक्सीन की विजिबिलिटी ओपन मार्केट में तभी आएगी जब दो चीज़ें होंगी. एक तो ये हुआ कि हमारा जो हमारे प्राइम टारगेट्स हैं लोगों जिनको वैक्सीनेट करना है वो कवर हो जाए, और दूसरा ऐसा हो कि देयर इज़ इक्विवेलेंस ऑफ सप्लाई एंड डिमांड. जितना डिमांड है उतना सप्लाई भी होना चाहिए. अगर वो मैच नहीं कर रहा है तो हमें प्रायोरिटाइज़ करना पड़ेगा. अगर ऐसे होगा कि आपके पास सप्लाई इतना ज़्यादा है कि आप डिमांड जो है उससे ज़्यादा है, तो फिर वैक्सीन जो है मार्केट में आ सकती है. होपफुली ये सिचुएशन जो है एंड ऑफ दिस ईयर तक हो जाए या उससे पहले भी हो सकती है. देन देयर विल बी लाइकलीहुड की जो वैक्सीन है वो मार्केट में आ सकती है.